My name is Darius Moezzi, and I'm one of the associate editors for the Journal of Arthroscopy. Welcome to the January 2015 issue from Flagstaff, Arizona. Please join me to celebrate the 30th anniversary of the journal. I encourage our audience to read the editorial by Editor-in-Chief Dr. Jim Lubowitz that touches upon the significant increase in journal submissions, the quality and potentially greater clinical significance of non-level 1 studies and impact in our practices, and the continued improvement in the platform for our online video companion, Arthroscopy Techniques. I encourage our readers to visit arthroscopytechniques.org to view some fantastic surgical videos. Our January issue contains 15 original articles, 2 meta-analyses, 2 systematic reviews, and clinically relevant Level 5 evidence and case report. 2 of the original articles have accompanying video. The first, from Dr. Jo Chul Yu and colleagues from Samsung Medical Center in Korea, present a paper entitled Subscapularis Tendon Tear Classification based on 3D anatomic footprint, a cadaveric and prospective clinical observation study. There is indeed an increased awareness of subscapularis tears, though a universally accepted classification system does not exist. As the tendon has very long and broad fibers that insert at varying orientations, a better understanding of the footprint anatomy could potentially and more accurately define tear size and lead to such a classification system. The purpose of the study was to define the subscapularis footprint anatomy in a 3-dimensional perspective, report the incidence of such tears, and classify the tears in a prospective manner. Thus, the study included both a cadaveric assessment as well as a prospective clinical observational component. The authors break down the insertion anatomy into 4 defined insertion points, or what they refer to as facets. A 5-category classification system of such tears is presented. It was noted that the upper or first facet at the lesser tuberosity encompassed 34% of the entire footprint, and that the first 2 facets made up 60% of the footprint. Clinically, among 821 shoulder arthroscopies performed, the overall incidence of subscapularis pathology was 50.5%. Among these tears, 80% are less or equal to first facet tears. A superb comparative analysis with existing literature is presented, and the authors note that they are performing a prospective analysis of the most common tear pattern that encompasses approximately 1/3 of the footprint length in a repair versus non-repair manner, the results of which may guide our treatment of such partial subscapularis tears. The second article with accompanying video is by Dr. Peter Fauno and colleagues from Denmark, entitled Analgesic Effect of Hamstring Block After Anterior Cruciate Ligament Reconstruction Compared to Placebo, a prospective randomized study. The purpose of their study was to evaluate the effect of a hamstring block using 20 cc's of 0.25% bupivacaine. All patients underwent primary ACL surgery with hamstring tendon autograft, and all received a femoral nerve block and general anesthesia. The hamstring block was performed through the harvestation site utilizing a catheter. A numeric rating scale was utilized, and scores above 3 at rest and 5 with activity were the triggers to administer either fentanyl or morphine. Such scores were kept by patients for a total of 8 days postoperatively. Pain scores were notably higher in the placebo group, with 13 of 22 patients rating their pain above 5 within the first 6 hours of surgery, and 5 of 23 patients in the treated group with such early pain scores. The study demonstrated that no additional differences were seen after 6 hours, which did correspond to the expected duration of the bupivacaine. The study did demonstrate a reduction in the use of opioids, which may have the additional benefit of the reduction of postoperative nausea and vomiting, though this was not assessed. The findings may result in decreased hospital recovery time and increased patient throughput. Additional articles of interest include a meta-analysis by Dr. Zhao and colleagues from China that include 8 randomized controlled trials assessing the efficacy of platelet-rich plasma use in arthroscopic rotator cuff repair. The study concluded that the use of PRP in full-thickness rotator cuff repair compared to those without PRP was not supported due to similar re-tear rates and similar clinical outcomes. The use of biologics continues to evolve and certainly warrants study, and the methods to stimulate and improve rotator cuff healing continue to both frustrate and mystify. Please enjoy this month's journal. As always, we welcome additional reviewers, and if any of our readership is interested to be a reviewer, please contact the editorial office, and Happy New Year.